Guys, happy Sunday and welcome to another episode of Public Health Matters with Martha. Today we'll be looking at the topic depression. Depression is a common and very serious medical illness that affects a person's feelings, thoughts, and actions negatively. It can lead to varieties of physical and emotional problems which can prevent the person from functioning very well at work or even at home. And there are so many symptoms associated with depression. It includes sad feelings and lack of interest in pleasure activities the person once enjoyed, lack of sexual desire, changes in appetite that could lead to weight gain or weight loss that is unrelated to dieting. The person is likely to find difficulty in sleeping or sleeping way too much. There's usually this difficulty in thinking and concentrating, loss of energy and unnecessary tiredness, feeling worthless and guilty, and oftentimes thoughts of death and suicide. And for diagnosis of depression to be made, the symptom must last at least 2 weeks. And sadness and depression are two different things. It is very normal for someone to be sad. Of course, certain situations, losing a loved one and some other situations could make somebody sad, and sadness should not be confused with depression. And most times other medical conditions could present as symptoms of depression. These include brain tumor, thyroid problems, and deficiency in some vitamins. So it is important to rule out other medical conditions before depression can be diagnosed. Certain factors are responsible for depression, and one of the factors includes early childhood trauma. Early childhood trauma such as rape, parental divorce, and neglect. Others include differences in certain chemicals in the brain, continuous exposure to violence. People with low self-esteem who are easily overwhelmed by stress are more likely to get depressed. And there are two major types of depression, which are major depressive disorder and persistent depressive disorder. Major depressive disorder is severe and the symptoms do not go away on its own. One needs to have at least 5 symptoms present for a period of 2 weeks before a medical depression can be diagnosed. It is usually accompanied with persistent feeling of sadness, hopelessness, and worthlessness. Then the second one is the persistent. Persistent depressive disorder is not as severe as a major depressive disorder, but it is mild and chronic. And symptoms must last for at least 2 years before persistent depressive disorder can be diagnosed. It is common for people with persistent depressive disorder to feel hopeless, to lose interest in activities, to have low self-esteem and lack productivity. Depression can be treated, but sticking to the treatment plan is very important. And treatment can be achieved through talking to a psychologist or a psychotherapist. But self-treatment can also be achieved through regular physical exercise, socialization, having enough sleep, and avoiding stress. Like the World Health Organization would describe or would define health as a complete state of physical, mental, in fact, the indices of health, because there are different indices of health, and not just merely the absence of diseases and infirmity. So if one is not emotionally healthy, then the person is sick. Depression is often associated with suicidal tendencies. So please, if you are depressed or you know anyone that is depressed, please do well to talk to someone, do well to socialize, and do well to help yourself and help others around you. Thank you, and see you next Sunday. Do well to